My presentation is on asthma. People who have asthma have inflamed airways. The inflammation makes the airways swollen and very sensitive. When the airways react, the muscles around them tighten. This narrows the airways, causing less air to flow into the lungs. The swelling also can worsen, making the airways even narrower. Cells in the airways might make more mucus than usual. This mucus is a sticky, thick liquid that can further narrow the airways. This can make breathing difficult and trigger symptoms like coughing, wheezing, shortness of breath. Not all people, though, who have asthma have these symptoms, and having these symptoms doesn't necessarily mean you have asthma. The causes of asthma isn't known. Researchers think some genetic and environmental factors interact to cause asthma, most often early in life. These factors include an inherent tendency to develop allergies called atopy. Parents who have asthma, certain respiratory infections during childhood, contact with some airborne allergens, or exposure to some viral infections in infancy or in early childhood when the immune system is still developing. There are 3 types of triggers. For some people, asthma signs and symptoms flare up in certain situations, and these can include exercise-induced asthma, which is where the cold and dry air makes it worse. Occupational asthma. This is triggered by workplace irritants such as chemical fumes, gases, or dust. Also, allergy-induced asthma, triggered by airborne substances such as pollen, mold spores, cockroach waste, or particles of skin and dry saliva shed by pets. Asthma has no cure. Even when you feel fine, you still have the disease, and it can flare up at any time. Asthma is treated with 2 kinds of medicine: quick relief medications to stop asthma symptoms and long-term controlled medications to prevent symptoms. An individual must learn how to use this medication correctly and when to use it. It's also important that the individual records their symptoms so they can have regular checkups with their physicians so they can assess the level of the asthma control and how it is controlled, and they can adjust the medication and treatment as needed. Remember that there is no cure to asthma. The main goal of asthma treatment is to achieve the best control of your asthma using the least amount of medicine, which this may require frequent adjustments to your treatment plan and visits to your doctor. Thank you.